This week on Healthy Living, a look at the health and well-being of refugees as millions face acute food shortages in Sudan. And a groundbreaking clinical trial in South Africa could mark a pivotal moment in the fight against tuberculosis. Plus, can pink noise enhance sleep and memory? These stories and more in this edition of Healthy Living. Hello, I'm Linor Moudou. Thank you for joining us for another edition of Healthy Living. The UN Refugee Agency, UNHCR's 2024 Global Trends Report reveals that forced displacement has increased to historic new levels worldwide over the past 2 years. The devastating war in Sudan has contributed to the spike. Since April 2023, more than 7.1 million people have been displaced within the country, and almost 2 million have been forced to flee to neighboring countries. Observers say refugee camps are overcrowded and underfunded, lacking essential services such as clean water, sanitation, and health care. Compounding this dire situation is a widespread malnutrition crisis. A preliminary projection by the Integrated Food Security Phase Classification states that more than 750,000 people will be suffering catastrophic food shortages in the coming months.
More than 750 million people could face catastrophic food shortages in Sudan by September. That's according to a preliminary projection used by United Nations agencies and aid groups to determine whether a famine should be officially declared. The preliminary results, as of June 1st, represent a rapidly deteriorating situation in the war-torn country. Since April last year, the Sudanese army has been fighting the paramilitary Rapid Support Forces. WHO Director General Tedros Adhanom Ghebreyesus said 12 million people have been displaced in what is the world's largest humanitarian crisis.
People are dying from a lack of access to essential services and medicines, while there is a very real risk of mass starvation in some regions.
The latest projection by the Integrated Food Security Phase Classification, or IPC, states that between June and September, an estimated 756,000 people will be in Phase 5 catastrophe. That means the country has not yet reached famine, but is still considered a major crisis. Famine occurs when a country has such a severe food shortage that its population faces acute malnutrition, starvation, or death. The latest projection is preliminary and could change. It would also require approval by Sudan's military government, as well as UN and international agencies. Whether a famine could be declared is unclear. However, U.S. Special Envoy to Sudan said recently that some parts of the country are already there. The question, Tom Perriello said, is how much famine, how much of the country, and for how long.
We met some refugees at the internally displaced camp in Wulari, Maiduguri, Borno State, northern Nigeria, and asked them to share some of their health and wellness challenges and hopes. Here is more.
As an individual, when I arrived here, I was so well, I don't have any problem. But after 3 months or 4 months of being as an IDP here, I had a lot of trauma. Thereby, I discovered that I had diabetics, ulcer, very chronic malaria, and typhoid. And you know, diabetes is very expensive. I have a different food being recommended by the medical doctor, and I cannot afford to supply them for me to eat. So anything come across my way, I used to eat, and the sugar level continued to increase. That's how I found myself. So it's a very big health challenge.
When I was in our village, I don't know what is called toilet infection. But now we are facing challenge about toilet infection. all girls are passing it, all women, men and women, we are passing of these thing issues called toilet infection, malaria, fever. Personally, me, before I don't know what is malaria, but when I stay here in IDP camp during to the mosquitoes, the room that is not in order.
We are facing different health challenges, especially our elderly ones. Some are passing through sugar, waste, other things. Children are passing through like malaria, fever. We even have some that are having a mental problem. Like now is the time for rainy season. I face like fever, cough, catarrh, and different headache because change of weather. Some of us went to farm to get to, they will sell their products and get money to go and buy medicine.
Humanitarian agencies are sounding the alarm on the devastating situation in Sudan. Here is more from an expert.
Yeah, so the war in Sudan has been ongoing for over a year now, and the situation is catastrophic across a country that is the third one most populated in Africa. It's a country the size of countries like Spain in terms of population, nearly 50 million, half of them are in need of humanitarian assistance, a fifth of them have been forced out of their homes. Today, people in Sudan are lacking a proper shelter, food, they are lacking access to healthcare. Many health structures are not functional, particularly in the conflict areas, and the situation is desperate. And we are already seeing a problem of malnutrition in different areas of Sudan. For example, in North Darfur state, in the Samsam camp where MSF teams are working, we did a mass screening of more than 40,000 children, in total about 60,000 plus children and breastfeeding women and pregnant women. And the rates of malnutrition were very, very high, above the emergency threshold. Vaccines are running short in many areas of the country. And this is why we are also very concerned, because in the past year, we have already seen different outbreaks of disease, for example, of measles, for example, of cholera. And this is something that can be recurrent if action is not taken, if vaccines are not provided to the children, to the vulnerable groups. No? So what we are calling is for the United Nations to exert an adequate leadership at the height of this crisis, but also to the other international organizations to step up their efforts to provide assistance, and to the authorities, to both warring parties, to allow unimpeded access to the populations in need wherever they are, no? Because we think that part of the problem in scaling up the response to the current situation in Sudan is the obstructions that we are facing by the different authorities. We are talking about probably either one of the highest displacement crises. We are talking about nearly 10 million people that in the course of the last year have been forced out of their homes. And we are talking about a crisis that is profoundly neglected by the international community. There is barely attention being paid to what's happening in Sudan. We need that people pay more attention about what's happening in Sudan, because there is a lot of suffering, and much more can be done, and should be done soon. Yeah?
A groundbreaking clinical trial is underway in South Africa, marking a pivotal moment in the fight against tuberculosis. The new vaccine could potentially become the first to help prevent pulmonary TB in adolescents and adults, the most common form of the disease, and the first new TB vaccine in more than a century. Zahir Kasim has the story.
Tuberculosis is one of the deadliest diseases globally. It's the main cause of death for people with HIV, virus that causes AIDS, and kills about 1.5 million annually, despite being curable and treatable. Dr. Numpulelo Mutupa is at the forefront of this battle. She oversees the TB unit at a prominent government hospital in Johannesburg. She confronts the harsh reality that many individuals in South Africa die with TB because they do not receive timely treatment or continue with the prescribed medication. The new M72 vaccine trial offers renewed optimism for curbing the prevalence of TB.
We want to end TB, but we don't have much. Even drugs that are being developed for TB, we've got very few drugs that are developed for TB per period of time. This vaccine is going to help quite a lot.
In many parts of South Africa, testing is done in mobile clinics like this. The vaccine works with people who have latent TB. This is when the infection is in the body, but the individual does not feel sick and cannot spread the disease. TB only becomes active if the immune system weakens, so it is dangerous when immunity is compromised, such as for HIV or AIDS patients. The M72 vaccine trial, headed by the Bill and Melinda Gates Medical Research Institute and the Wellcome Trust, represents a collaborative effort involving up to 20,000 participants. The study includes 60 sites globally, with 32 sites in South Africa.
But there's also an epidemiological benefit as well, because TB is primarily transmitted from individuals who have, in fact, active tuberculosis. So by lessening the overall number of individuals in a population, particularly in a population with a high burden of latent TB who have active tuberculosis, that in turn will prevent the further transmission of the infection to other individuals who are not already infected and prevent them from becoming infected.
Experts agree that the only way to put a dent in TB rates is by testing, like this clinic, and by creating a vaccine that works for adolescents and adults. Experts say the M72 vaccine offers great promise with this demographic.
So this is the first vaccine new vaccine that has shown some efficacy, which means protection against adolescents and adults in early clinical trials.
A 50% efficacy rate could save 8.5 million lives and prevent 76 million new cases, according to the World Health Organization. Results of the vaccine trials will be out in 5 years, and if successful, the vaccine rollout could begin in 2030. Zay Kasim, VOA News, Johannesburg, South Africa.
There is a growing buzz around pink noise, brown noise, green noise, a rainbow of soothing sounds, and their theoretical effects on sleep, concentration, and the relaxation response. The science is new with only a few small studies behind it, but thousands of people are already embracing it on meditation apps and YouTube.
White noise is like a static, whereas brown noise is lower, like a soothing rumble, and green noise is somewhere between white and brown noise. Scientists don't know which color is best. Dr. Ronil Markani is a researcher at Northwestern looking into the science behind pink noise.
What we're trying to do with this research is to stimulate or boost slow wave sleep, which is one form of deep sleep. And pink noise mirrors the types of frequencies seen in that stage of sleep.
These slow brain waves that Dr. Malkani is studying happen during a person's deep sleep, which is pivotal for a restful night.
What we're doing in our research here is to give sounds in a different way. The sounds that we are giving are specifically intended to enhance or boost the slow waves in slow wave sleep. To do that, we give short pulses of pink noise at specific times during the slow waves.
In these small studies, adults saw better memory recall after they slept with the pink noise sound pulses. The research holds promise for benefits beyond a good night's sleep.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on X at Linoch Mudu. Until next time, stay well and strive to make every day a healthy day.